condom, unfortunately, is fading out of the system, kakra, because a lot of people are not purchasing it. Most people are rather going for the male condoms. It's very easy to get, it's not expensive. You can just go to any pharmacy to get it. We use the condoms also because we want to avoid getting sexually transmitted infections, but mostly because we don't want to get pregnant. There are some people who are a bit skeptical about using the modern contraception because they think that they have drugs that they're going to have side effects and all that. And you don't even know how to use your cycle or how to use the calendar. The condoms will work for you. But just like everything else, the condoms also have their own disadvantage. So if not worn properly, it can slip off, it can burst. Some people also claim it reduces the sensation of the whole act. So it's not getting the kind of attention it's supposed to, let me just say. So that's why we have the other options for if you can't use the condoms. So we have pills that we use. The pills are supposed to be taken every single day. So I brought a few of the samples. I don't know if you can see from where you are, but I'll just try and show it. So the pills are a bit like this. They are very small pills. Small pills, it makes it easy to swallow. And it's convenient such that you can even keep it in your pocket. But it has to be taken one every day at the same time. Oh yeah, thank you. So for anyone who is forgetful or anyone who really doesn't like taking pills, then maybe the pills won't be too good for them. Yes, because if you are taking it and you forget to take a pill or you forget to take it on time, it doesn't work. Some people take pills every day, but because they don't take it on time, it fails. Before you realize, they are telling that, oh, I used the family planning and it failed. It didn't fail, you just didn't take it well. That's how the pills is. It's supposed to be taking one every day at the same time. Okay, we have two different types of the pills. There's one that is for breastfeeding mothers, and then the other one is for everybody else, except the breastfeeding mothers. Apart from the pills, so let's say that you have a problem taking the pill, or you think that you forget to take a pill, you can't take it every day. We have injections that we give. The injections are supposed to be taken every 3 months. It's taken on the shoulder. It's supposed to be taken every 3 months. This one also works for those who want to wait for a short period. Let's say you want to wait for a year, or maybe up to 2 years. The pills or the injection will be good for you. Yes. So that's the 3 months injection, yes. So, like I said, it works best for those who want it for a short period. Despite the fact that it's for those who want it for a short period, if you are comfortable taking the pills and you want to take it for as long as you want, it's fine. It still works for you. So no problem. You can just take it every 3 months for as long as you don't want to have a child. That is for the 3 months injection. And then she's still bringing the pills around, but I'll just move on. So we have this we call the implant. I'll let her pass it around when she comes here. So the implant is rubber-like. It's just rubber, but it has some medication inside. And it's the medication that protects you from getting pregnant. We have one we can use for 3 years and another we can use for 5 years. So the pills, the injections are considered for short-term use. The 3 years, the 5 years are considered for long-term use. That's the implants. So the implants, like I said, we have for 3 years and then for 5 years. You decide which one you want to do, depending on how long you want to wait to have a child. If you want to wait for just 3 years, you can just go for the 3 years one. If you want to wait for 4 years or 5 years, you can go for the 5 years one. Even though the period is for the whole 3 years or for the whole 5 years, it doesn't necessarily have to be there that whole time. Some people assume that because it's for 3 years, if I take it out before 3 years, it will still have to work for 3 years before I get pregnant. It doesn't work like that. As soon as the implant is out, the effect of the drug leaves the system completely, which means that you can get pregnant as soon as you take it out. So we always encourage that take it out whenever you think you are ready to have a child. Otherwise, when you have reached menopause and you think that at this point, there's no way I can get pregnant, and we are also sure that you have reached menopause, we will take it out for you. And then we have what we call the IUD. I know a lot of people have heard about the IUD. We have 2 types of the IUD. The brown one is the copper IUD. The white one is hormonal IUD. So the copper IUD is non-hormonal. In fact, of all the family planning methods, aside the condoms, the copper is the only other non-hormonal family planning method. That just means that it doesn't have any drugs in it. The hormones are the drugs in the family planning method that protects you from getting pregnant. The hormone is called progestin. It's the type of hormone a woman has in her body when she's pregnant or when she's breastfeeding, or the kind of hormone that prevents ovulation in the first place. So they use the hormone for most of the family planning methods so that it works by preventing ovulation, and then you don't get pregnant because there's no ovulation. So with the IUDs, we have the hormonal one, and we also have the copper one that is non-hormonal. So let's say you have used any of the hormonals, or you have tried some of them, and you had any effects with it, or you're uncomfortable with your experience, and you want something different, you go for the non-hormonal IUD. The copper IUD can be used for up to 10 years, even 12 years, yes. So we use it for 10 to 12 years. It's such that if you get to the point that you think you don't want to have any more children, it helps, because that will be there till you reach menopause or something. But also, it can be used at any time. It can be taken out at any time. Like I said, if you have used any of the hormonals and you had an issue with it, you want to do something else, you can go ahead and do the IUD and take it out whenever you are ready to have a child, even if it's just in 2 years. Thank you. Even if it's just in 2 years or 3 years, or even if it's just a year, you can still come and take it out whenever you are ready to get pregnant. And same goes for the IUD. As soon as it's out, immediately there's no protection anymore, which means that you can get pregnant as soon as you take it out. So again, we expect you to take it out when you think that you are ready to have a child, and not before that. The hormonal IUD can be used for up to 5 years. It works just like the other hormonal implants, but the effect for the hormonal IUD is a bit different from the implant, such that the implant is placed under the skin on the upper arm. So the drug is released into the whole system. So sometimes you might have some kind of side effects or some experiences with it. But with the hormonal IUD, it's placed directly into the womb, which means that its effect is directly in the womb where we expect it to work. So then you don't have any systemic effects with the hormonal IUD as you would with the implant or the other hormonals. Please, I hope you are following. Okay. So family planning, most of them have a bit of side effects, okay? I know that's what a lot of people are worried about, but side effects are manageable. Side effects are always manageable, okay? When you have any of the side effects and we think that this is a bit much or maybe it's a complication, we would actually take it out for you and then do a different one. Even though they are all hormonal, they all work very differently. So if you take the pills and you have a problem, doesn't mean that if you take the injection, you're going to have the same problem. If you do the implants and you have a problem, it doesn't mean if you do the IUD, you have the same problem, because each one works differently. So the common side effects with the hormonals, that's the injection, the pills, the implants. The common side effects with it is the first few months after you've inserted it, some people tend to have a bit of menstrual changes. So it's either your menses is not coming at all, or the amount of flow is reduced. Sometimes the number of days is reduced. In few cases, we have increased number of days or increased flow. So we always tell you what to look out for, so that if it gets to a certain point, maybe after 10 days you're still menstruating, it hasn't stopped, you need to report back to the clinic. We'll give you medication for the bleeding to stop. Like I said, side effects are manageable. So if you're having maybe prolonged bleeding, it doesn't mean the thing is not working well for you or any body injury. It just means that you're having some side effects that we can take care of. And then also some slight effects that we might experience, maybe some headaches or some general body weakness. Some people tend to have a bit of a breast tenderness. Some people gain weight. Those ones are all side effects which, like I said, are manageable. Most of the time, within the first few weeks, all those effects actually resolve by itself. The weight gain, it's not exactly a problem in the sense that the hormonals itself usually just adds about 2% of your weight if you have taken it for a long time, like maybe over 2 years. But if you realize that you are gaining a bit weight, or maybe you are eating too much, or you are eating late, or sometimes you just have to check your diet or do what you need to do to check yourself, but not necessarily the thing making you gain so much weight. Yes, it can cause a bit of weight gain, but it is controlled weight. Please, I hope we understand. Are we following? Okay. All right, so with the IUD, the copper IUD, the side effects we can experience with it is there can be heavy bleeding the first few months after the insertion, and some people also tend to experience menstrual cramps after the insertion the first few months. Usually, like between 3 to 4 months, the menses get heavier with cramps, but it resolves after time, and then it goes back to normal. And most people even get lighter bleeding after the few months. The last one I'll talk about is the Permanence Method. So for those who have gotten to the point where they are very sure that they don't want to have any more children, we have Permanence Methods. So the Permanence Method is a surgery we have for the men and for the women as well. So if the woman is sure, or if the couple are sure that they don't want to have any more children, the woman can come in, we do our necessary checks, and then after the counseling, we take her to the theater. We just tie the tubes. And the tubes is where the eggs will pass through for fertilization to take place for the woman to get pregnant. But when we tie the tubes, it means that we are blocking the space, or we are blocking any chance of the sperm meeting the egg for fertilization to take place. But that is permanent. And we do same for the men as well. Okay, so for the men too, it's a surgery, but it's a minor surgery. Okay, these ones, they are all minor surgeries. They are the kind of surgeries that will be done in less than an hour, and then we allow you to rest for like another hour or two when you're out of the hospital, and you're fine. It's a minor surgery, and it's permanent. So you need to be very sure that this is what you really want, because in the near future, you can't decide that, okay, I think I might want to have one, or right now I've gotten to the point where I think I need to settle and have one. It won't happen because it's permanent. Please, I hope you understand. Yes. So I'll just say in summary, that's what contraception is about. We are going to leave the rest of the time for the questioning, and We'll be here to answer any questions that you have. Thank you.
Thank you. Please give it a round of applause. Thank you so much, Frederica. Please, you can have a seat. Yeah.
Do I hold it?
Yeah. So it's now time for the panel discussion. Please, if you have any questions, everything she's speaking about, if you have questions so far, you can put them down or you can keep them in your mind. So when it's time for questions and answers, you come and use the microphone here and ask your question. Now I'm going to call on James McKeown, another health professional, to join us up on this stage. We are waiting on one other lady, Abigail York, but she's not here. When she gets here, we will invite her as well. So now we're going to have James and Frederica to start the panel conversation with. I have some questions that I'm going to go ahead and ask them, and that will start off the discussion. But please, if you do have questions, you can actually come and sit here. That is to my right. That will indicate to me that you have a question and ready to ask. I can pause through the conversation or the discussion, and you can come and ask your question. Then our health professionals will give you the answer. Hello. Okay. So Frederica has done a brilliant work by taking us through what contraceptives are in general, and she has spoken about the types. But my next question would be, what factors should one consider when choosing birth control? Is it just by spacing of the kids, or you think you're done, or there could be other factors where you would recommend that a couple or an individual chooses contraceptives?
All right, so before we get married, I'm sure as part of the counseling, we talk about how many children we want to have, or even whether we want to have children. Yes, so when you have decided on whether you want to have children or how many children you want to have, and we always encourage that we also talk about the spacing between the children. Okay, it's very necessary. Some people just talk about the fact that, oh, I want 3 kids or I want 4 kids, and that's it. They don't decide how and when they want the kids to come. And after the first one, when they probably have gone through a lot of stress with the first pregnancy, then now they want to change their minds or they are not ready, and before you realize you are pregnant again, and then it brings another stress. So we always would like to talk about the options for contraception at antenatal. So as at when you have gotten pregnant and you start coming for antenatal is where we start talking to you about about the need for contraception. For you to decide which one, it depends on how long you want to wait to have a child, or how many children you even want to have, and also about how old the woman is. Sometimes we forget that. But a lot of women always have this in mind that that's actually a very wrong thing to do, because the more you are giving birth, like with a short interval, the higher the risk of each pregnancy that comes on the woman and on the baby as well. So that's why we always want to talk about contraception during antenatal. Some people will talk about the fact that they are growing old, so they want to hurry up. Some people are still very young, and they tell you, I want to have 4 kids, so I want to finish having my kids early so that I can live my life. Yes, we do that, but that is wrong. But again, to choose the contraceptive method, in the first place, it depends on how old you are, how many children you want to have, and how much space you want to put in between the children. Then we'll help you to decide on which method will be good for you.
Okay, that's good to know.
If you just to say that,
Yeah.
she mentioned spacing, and I think it's something we need to stress on.
Yeah.
Because when a woman goes through the 9 months of pregnancy, a lot of hormonal changes the period of delivering has a lot of issues that comes with it. Now, the woman needs time to recover. Oftentimes, as they are recovering, they get pregnant again. And then it puts a lot of stress on the woman. I know women who end up bleeding, having other complications, because the body didn't have the right time to recover after the delivery. So we need to talk about spacing for the woman's health, not for the child who's giving birth to, that the child can also get some time to get the love and affection that the baby needs. Someone gives birth, 9 months, she gets pregnant again. That 9 months, baby will not get the same attention and love and care that you will have gotten because the mom is pregnant now. So now the woman needs time to focus on the baby that she's in her and all of the difficulty that comes. So we need to really speak about its use for spacing. But she mentioned age. We also look at the age as well. And the society also gives pressure at times. So you have one, they ask, when are you giving the second child? Someone says, oh, but when you know, when is the third one coming? So we also need to check all of this. We don't allow the pressure from outside to push us into. We need to also look at the health of the woman, the child that giving birth to, the attention the child needs, and how to space the children so you can get even the best of care from us. Thank you.
Thank you so much, James. I can see Auntie S.D.A is ready with the question, so please go ahead.
Good afternoon to you all. Thank you, the Frederica. Good. I missed a lot of your presentation, but there's one key thing that I want you to kind of touch on a bit more. Of late, we have a lot of young people using contraceptives before marriage because they are sexually active and they're trying to avoid pregnancy. But I got to know also that some of the pills, the effect of it could be breast lumps, which can progress into breast cancer, just using it anyhow. And some just walk into the pharmacy and buy what they've heard of in an advert a friend has recommended without being married. They just take them anyhow. And I know it has a long-term effect. So I want you to touch a bit on that. The second one I want to know is about the IUD. The IUD, I hear there are two different kinds. One is non-hormonal, and one is hormonal. So if you can explain it. I have used the non-hormonal for over 10 years, right? And fixed another one. It's been very convenient, except a point where I had an ovarian cyst, and it started pushing out and all that. I didn't know whether it was the cost of the IUD or something else. So they had to take it out and replace it. So if you could explain a bit on the hormonal one and the non-hormonal, so the young ones who want to take it or fix it can advise themselves on which one to go for. Thank you.
Okay, so to answer her question, the first one was about the pills. So with the pills, yes, for those who usually take the emergency contraceptive pills, they tend to have a long-term effect with it. The short-term effects will be the menstrual changes that they will see, or they won't have their menses at all, or some of them tend to go through a lot of pain or heavy bleeding and all of that. But emergency contraceptive is supposed to be taken twice a year. It's supposed to be for emergencies and not every time you have unprotected sex. It's supposed to be taken twice a year. For the oral pills, I mentioned earlier that it's supposed to be for a short period. Okay, we are looking at taking the pill for like a year or 2 or even 3 years. When you have taken the pill for a long period of time, you have taken it for more than 10 years, it increases your risk of getting breast cancer. It's not directly the pills giving you the breast cancer, but there are a lot of risk a woman has to get breast cancer. And the prolonged use of the pills for more than 10 years adds up to the risk that you have for the breast cancer. So we don't encourage taking the pill for a long period of time. If you are taking it, you stop to get pregnant, you take it, you stop to get pregnant, that's okay. But when you have gotten to the point where you're sure you don't want to have any more children, it's better to do a method that will last a bit longer than just still taking the pill for a long period till you get to menopause, because it increases your risk of getting the breast cancer. Okay. For the IUDs, I mentioned it during my presentation. I mentioned that we have the hormonal one and the non-hormonal one. And the hormonal one is used for 5 years. The non-hormonal one is used for 10 to 12 years. The hormonal one has medication in it like the other hormonal drugs. That's why that expires after 5 years. The non-hormonal one doesn't have any drug in it, so it can even be there for as long as 15 years. But up to 12 years, the idea is it's been there long enough. Let's just take it out and replace it, especially if you haven't reached menopause. And because it's non-hormonal and there are no drugs in it, the side effects with it is very, very minimal. I mentioned earlier that the only effect you might have with it is the heavy menses during the first few months, and then some people tend to have cramps the first few months. But after that, there's no problem with the IUD after that. It doesn't release any kind of drugs that would go through the system that will cause any systemic effects as with the other hormonal drugs. But with the hormonal IUD, because it's also placed directly into the womb, its effect is mostly in the womb. So it works mainly by preventing ovulation, which in effect, you won't also have your menses. So with the hormonal IUD, when you start using it, at a point, the menses stops. You don't have your menses till the 5 years. And that's how it works. It's normal. It doesn't cause any problem after that.
Thank you. Just to add up to what Auntie Esther asked, you know the IUD, you mentioned that she had the copper. So there's a question as to whether it rusts in the body. And then just to speak on the cyst, there have been stories that it causes cancer. I don't know whether it's true or it's false. If it is true, what causes this?
So copper IUD, does copper rust?
No, it doesn't. But apparently
No,
some people
copper
say
doesn't
it
rust.
rusts in them.
No. Copper doesn't rust. All right? That's why they decided to use that one for the IUD. Copper doesn't rust. And naturally, it's like the sperms react to the copper ions. Okay? So that's why they use it for the IUD and place it in the womb. The only people who cannot use a copper IUD are those who react to the copper. So you see, there are some people who, when they wear the copper earrings, they have the sores or the rash on the ears. They react to it. It doesn't mean that the thing is rusting on the ear. It just means that they are reacting to it. They are the only ones who cannot use the copper IUD. Because if you are reacting to it on your body, when we place it in your womb, you are going to react to it. But copper doesn't rust. Okay? Copper doesn't rust. There's no way a copper IUD is going to rust in your womb. Because anytime a copper IUD is taken out, even after 10 years or 12 years, we always show it to the woman. And you will see it exactly how it was placed. It doesn't rust. And the story about copper causing cancer, I know about that story. In fact, unfortunately, during that week, we had a lot of people coming to the unit to take it out because Tracy said, unfortunately. But there's no relation between copper IUD and cervical cancer. Okay? Cervical cancer is cancer of the cervix, which is the mouth of the uterus. It's caused by a virus, which is sexually transmitted. It has nothing to do with the IUD inside your womb. There are no relation between those two. Copper IUD cannot cause cancer even in the womb, much less cancer of the cervix. It's not possible.
Thank you so much for giving us hope and comfort that it doesn't rust and it doesn't give cancer. I can see Elder is ready for a question. Please, let's have your question.
Thank you, Madam Frederica. And, in your presentation, I may be wrong. All the methods talked about are artificial methods. Would there be a natural method that will be very effective? Given that we're talking about couples here, and we want to ensure we don't have other side effects. So if there are any other natural methods or herbal methods that you could also preach, would have you educate us on that so we can adapt to that too. Thank you.
Thank you so much, Elder. So, Frederica, are there natural methods that are less invasive that we will be more comfortable with, or herbs, as he said?
Please, we don't have any herbal method. In fact, that's the first thing I even want to talk about. We don't have anything like a herbal contraceptive method. Well, if there is, it hasn't been scientifically proven. So we don't know. I've actually heard people say that they've taken there are some concoctions that you take that you won't get pregnant. In the first place, you have no idea what that concoction is doing into your womb. If you have taken it for a period and you decide to go have a scan or a biopsy of the womb, you realize what is going on there. If it's working, it means that it's actually doing something it's not supposed to do in your body, which is not right. For the natural methods, yes, we have natural methods. I didn't mention it. I thought of mentioning it, but I decided not. I decided to hold on to it. So we do have natural methods. The bit about natural methods is they are not as effective as the artificial methods. Okay. When we talk about all the family planning methods, the implant is 99% effective. But the natural methods put together is like 67% effective. Even condoms is like 82% effective. So the natural methods are not as effective as the other contraceptive methods. And that's mostly because if we are going to use the natural methods, there are different types of it. Okay, we need to really teach you how to use it. It boils down to correct use and consistent use. It also boils down to having, how do we call it? A partner that's willing to help or that's supportive, okay? Because if you are using the calendar, there are close to 12 days or almost 19 days in between the cycle that you have to avoid sex, depending on what your cycle is. It can go up to 12 days. So if you don't have a partner who is willing or who is cooperative, it will be very difficult to say that for 12 days, please don't come near me. So then it doesn't make it very effective, okay? We have the calendar method. We have the calendar method. We have the withdrawal. We have what we call the cycle beads. The cycle beads also help you to, well, it depends on what your cycle is. So if you know your cycle, you can very easily use the cycle beads. Then if both you and your husband have agreed that we want to use the natural method, which means that there are certain periods in the month that we can't have sex, and there are certain days that we can have sex. When you are using the cycle beads, at least it helps you to know that, okay, so from this period up to this period, I'm possibly ovulating, so let's not have sex. And he won't touch you or he won't worry you. Then we don't have a problem. With when you come to the family planning units, we teach you all of that. But we hardly get people walking into the family planning unit to learn how to do the natural method, because in their minds, I just have to know my cycle. And they keep asking around and they keep telling them all sorts of things. Most of the time, they'll tell you 5 days after your menses end, you are safe. That's wrong. That's very wrong calculation. It doesn't, when we are talking about cycle, we start from the first day of the menses, not the last day of the menses. Otherwise, it will be difficult to calculate the cycle. Okay, sometimes we think that, okay, so on the 14th day, I'll be ovulating. So when I count for my first menses, then 14, no, usually they do it after the menses end. Then they count 14 days from there. If you are trying to get pregnant and you're using the calendar, and you are doing it like that, it will take years for you to get pregnant because it doesn't work like that.
And just to say that your stress level can also affect your period.
Yeah.
So if you have you know you have 28 days cycle, and there's pressure at work, and because of the pressure at work, it extends. You may think you are doing the natural fine plan, but you may get pregnant because the stress affected your ovulation, it affected your menses, and so you will not ovulate the time you are expecting to ovulate. It may go 2 or 3 days ahead or later, which will mean that you think that at that point you are safe, but you are not safe. You may get pregnant from that. Yeah.
So that's why I was saying that the natural methods are not very effective, because there are a lot of things that affect your cycle for you to tell for sure that this is it. And even with the withdrawal, some men really pride themselves with being good at withdrawal, but sometimes they forget that that's fluid that comes before the ejaculation itself can have a bit of the sperms inside. So it's not very effective.
Yes, the next voice you're going to hear is Mrs. Abigail York. She's joined us, and she's a personnel of the Planned Parenthood Association of Ghana. So please give her a round of applause. She's here now.
Good afternoon. It's unfortunate I had to be late because I didn't know the traffic. Yeah, it was terrible. So sorry for that's not my. That's not me. Thank you. I just want to add on to the natural method. It is good that sometimes you want to use the natural method, but at a point you don't have to play God, because you are not God. Because the time that you ovulate, yes, you can calculate, but the time you ovulate, you won't even know. Because sometimes the egg will just stay for some few hours and it's not there again. So the time you are thinking, I'm ovulating today, you have ovulated in the morning and the egg is no more. So if you are planning for this evening match, you have failed. Yes. Sometimes it is good that you observe, but know your cycle. Some have 21, some have 28, some have 30, some have 32. So where do you place yourself? So if you want to know your cycle, you have to study the cycle for about 6 months to know that I am 21, 28, 30, 32. And from that point too, when you are ovulating, there are so many things you have to observe. Your body temperature changes. Everything about the woman changes. Sometimes she will want to have sex. Sometimes she doesn't want you to come close. There is so much pain during the time. And sometimes the pain is even severe than when you are menstruating. And when you want to ease yourself and you want to push small, it pinches like there is something in your yash pinching you. So would you want your partner to come close to you? You wouldn't want. But that is the time maybe you are ovulating. So by the time, I am free from the pain and everything, I'm still ovulating, the egg is no more. So the pregnancy becomes an issue. And then also, if you are using maybe the withdrawal, as she rightly said, even the space that comes before you enter contains something. So he said, I'm very good. I will withdraw. Before you withdraw, he has already entered. So, you see, so it is good that sometimes we want to use the natural method. But there are so many things that you have to know before you can use the natural method. And that is why maybe God in his own wisdom has given knowledge to some people to do an artificial hormone that is going to act like the hormone itself. So that if you take, let's say, 3 months injection, then you can go to sleep, no pregnancy. If you want to have pregnancy, you stop. The cycle goes back to its normal state, and then you can get pregnant. A lot of women use it, And then even some, especially with the Jadel and then the implantum. There was this lady who was on 5 years. And he was thinking, oh, in June, my 5 years ends in June, maybe 20th. By the time she came for the removal, she was already about 3 weeks or 4 weeks pregnant or even more. Yes, even that one, sometimes it has its own thing. When people are on the implant, because it's hormone, some don't have their periods, some have spotting, some have prolonged bleeding and all that. But if the person is not having her period, she feels that blood is collected in the abdomen and therefore it will turn into fibroid. So I asked them, have you seen fibroids before? He said, no. I said, if you haven't seen it, don't say it for yourself, that I'm not having my period, and therefore, where is the blood collecting? The womb itself is just like a pear, which is turned upside down. So, like the syringe, bentua. But they are saying that blood is collected inside. So I wonder, where is the blood collecting and it's not coming out? You see, so sometimes the woman also needs to know herself and her body and how the body works. It takes the egg, it takes the preparing of the womb, and then it takes the cervical mucus for pregnancy to happen. The cervical mucus aids the movement of the sperm. As it's an accelerator, the sperm. And then the egg will have to be released and be waiting. And then we'll need the inner lining of the womb to prepare. Yasa bedsheet in a kama, kushiane te kwana ho. Na sperm no do open na pregnancy starts in the fallopian tubes. If the fallopian tube is fine, then pregnancy can start in there. So when we administer or introduce the artificial hormone, what it does is that it suppresses ovulation, and then it thins the lining of the womb. Bed sheet, it is a womb panel was Yawo empanisiwo, yawo blanket, and a yawo bed sheet. So what's a bed sheet and I will train what na wamba. Say by the end of the week, who be bed sheet no na wesi. Ain't ya train what no be amba. Kushiano so why disappointed. Well, ain't busum na the dead egg and the bed sheet comes out like your period. So if we introduce the hormone and it suppresses the egg, so nothing happened, it didn't come. Then the inner lining, the bed sheet wasn't laid. So will anything come? The third thing is that the cervical mucus is very slimy and it helps the movement of the sperm. So by introducing the natural artificial hormone, that mucus becomes very thick, so it makes it difficult for the sperm to swim through. So how is it going to enter, travel, and go up there into the fallopian tube for pregnancy to happen? It will not happen. So these are the three main things that the artificial hormone does. And that's the reason why when you are on it, you don't get pregnant. But immediately, you stop using the artificial hormone, everything goes back to its natural state. And then pregnancy can happen. Some are very, very much immediate. Some, it takes a little time. Little time, but it happens.
Thank you so much, Mrs. York. Still on the topic of the IUD, I have heard personally that you can lose it. the myth and the concerns is lost in there, and they can't find it, and they can't pull it out, and there's a foreign object inside them, and they don't know where it is. Please, is this even true? Can you lose an IUD in your body?
Wait, lose it? I said it goes where?
It's lost. You can't find it. It's moved from where they placed it, and it's...
No. It never happened. If an IED is going to come out, it will come out through your vagina. You would see it out through your vagina. Maybe you see it in your panty or something. But it doesn't move like she explained. The uterus is such that nothing goes out of the uterus. It only comes out through the vagina because of how the uterus is shaped like. So when an IED is inserted, and it's going to come out at any point, it's going to come through the vagina, not into the body anywhere. IED doesn't do that, no.
This is another big one, that hormonal contraceptives cause infertility. Oh, yeah. When you use it for a period of time and you want to give birth, as Mrs. York clearly said, sometimes it takes time, but maybe in that taking of the time, you are infertile because you used hormonal contraceptives. And so most of the women would rather risk using the natural ways than to go for the artificial means or methods.
Yeah. And that's the reason why we have all other options. So that if you feel that if I use the hormones, I will be infertile, use the IUD, which doesn't have, for the 10 years, it doesn't have any hormone. It's the 5 years that has hormone on it. And for the IUD, yes, some people will say that it's missing. Yes, there's a string that hangs on the IUD. And it gives you that sign and that the IUD is in place. But sometimes the string comes off. But when the string comes off, the piece is still inside the womb and it's still doing what it does. How it works is that you see the womb is just like my body and then my two hands. So the fallopian tubes, we have the left and then the right, and that is where the egg is. So the sperm will have to travel through the womb into the fallopian tube before pregnancy starts. So when we place the IUD, we place it here. It lies here and then this way. So what happens is that
I think she brought one around, if you saw it, yes. It's T-shaped. Where's the bring it back out? Okay, sure.
So please, this is what the uterus looks like. I don't know if you can see from that far, but that's what I was trying to do. When an IUD is placed in, come. Yes. Okay.
Yeah. So the IUD is placed at the top of the womb. We call that place the fundus, and that is where it is. So how it works is that the egg is coming from the fallopian tube. The sperm is coming from the vagina. So as the sperms are released into the vagina, they are supposed to swim very fast so they can get into the fallopian tube. And nothing should be an obstruction. So as the IUD is lying there, when the sperms are released, instead of them swimming smoothly, because of the IUD, it will be hitting against the IUD, and therefore it slows down the movement of the sperm. So that by the time it gets up there, it is either tired or dead, and therefore it can't enter the egg. That is all that the IUD does. And therefore, every month when it is there, the woman will ovulate, all right? She will have her period, but no pregnancy. That is all. Some women are so scared that they feel that Audia is somewhere close to the heart. Or no, it is not there. And the IUD, there is no way. I don't know whether it will be from your ancestors, where the IUD can get to your heart. No way. Maybe it will be from your ancestors. That one I can't explain. But there is no way the IUD will get up there. The only thing that the IUD will do is to drop. So that when it is inserted into the womb, we educate the woman that when you have your periods, sometimes because of the IUD, your periods are a bit heavy than the normal period. So that anytime you are to change your pad, you just inspect the pad before you discard. And therefore, if you have very heavy bleeding and it pushes the IUD out, at least you will see it. And that you won't say that it has traveled to your heart. There is no way.
If you want to say this,
Yeah, sure.
Oftentimes we listen to people, what is happening to them, and then we think that the same thing will happen to us. With my experience, the human body responds to things differently. So what works for her may not work for me. So the fact that she took the pills and it took her 6 months before she could get pregnant again, doesn't mean that when I take it, it will take the same 6 months. Actually, when someone had Jadel in, but she got pregnant before they removed it. So we should always go, anytime you're looking for medical advice or medical counseling, see yourself as one among the rest. What may apply to someone may not apply to you. So let's go, let them give you the counseling, the various methods, think through the side effects, and the one you want to do, just go for it. That's all I want to say.
Thank you so much. Please, you are reminded to kindly come and sit here if you have a question, and we will allow you to ask your question as we continue with the discussion. Because we want to exhaust all the questions before our time runs out. There's another one that's hormonal. So there's this question about the hormonal birth control affecting a person's emotions. I've personally heard a man telling his wife that she is irritable and angry all the time because of the IUD that she has in her arm. Is there any truth to it? Is he just trying to get out of the argument by using that as an excuse? The same way they say that, oh, are you on your period? Is that why you're emotional? Is there any truth to that at all?
Okay, so the hormonals, one of the side effects is mood swings or mood changes, okay? Just like when you're having your menses, you tend to have a bit of a hormonal imbalance, or that is also what causes the mood swings. Same goes for when you're using some of the hormonals. They do cause mood swings, but it's not something that lasts throughout the whole period that you are using the method. It comes and goes. But, yeah.
It does happen. So the man is not wrong, eh?
Maybe he was just exaggerating, because I don't think it's that bad.
Yeah, let me add on to what my sister said. When most women are on their hormones, some lose their libido. They lose their libido, the urge to have sex. They lose it. And also, some have this, before we have sex, the woman's vagina has to be a bit wet. But because of the hormone, you see, it's like you already have the hormone in your body, and it's like we have added on. So it's like the level has gone up. Ask yourself sometime when you are pregnant, why is it that you don't have your period? It is because the level of a hormone has gone up, and that is why you are not having your period. So if it happens that this woman is on the hormone, these are some of the things that happen, and therefore the woman doesn't want the man to come close because she doesn't have the edge. And sometimes, with all respect,
say it.
you voice your way, whichever, whether you have feelings for it or not. I will do what I will do, and it's painful. Please, it's painful. It's painful because the enjoyment that you are expecting me to have, I won't even have a tip of it, and therefore it's like you do your thing and get out. But at the end of it all, you will see that the woman has pain. Sometimes they have bruises because the vagina is very, very delicate.
Lubricated.
Yes, and because it's not lubricated, when you are having your way, the woman might have bruises. At the end of the day, you see her complaining that, oh, I have pain. When I it's burning. Yeah, inside the vagina, she feels that there is so much pain there. So that's what happens when the woman is on the hormone.
Right. Thank you so much.
Frederica mentioned that we need to cooperate with each other. So maybe, let's see how the cooperation can be built. Build that cooperation with them. So if today, don't use that as an excuse all the time, that I have low libido or I'm not wet, I can't. In that case, you're pushing them in. And a man who doesn't want to go outside because it's a sin will force you or do other things which you may not like.
Yeah,
so that cooperation.
Use the KY jelly.
Exactly.
Yes.
So at least
we have medication for that.
Yeah.
Like we're trying to say, it's not everybody who has that. It's one of the side effects, but not everybody who has that. We don't want the women to use it as an excuse because they know that it can happen. But some people genuinely have that. But we also have treatment for those. So people who have very low libido, we can definitely give you something for it. Or you can just use the lubrications to help the place, just so that it doesn't get too dry when you're having sex. At least it helps to even build a bit of feelings when you're having the sex. So yeah. It shouldn't be an excuse.
At all, it shouldn't be an excuse. And maybe you just take the more work to get the woman ready for the action. Just saying.
And the woman to work to and meet us halfway.
I just want to say, Frederica, you see, it's not fair when you just have to let him use a lubrication to have his fun and walk away and leave you a bit, I don't know. And that's what makes us irritable. And, what you were saying, sometimes the men just uses us and leave us without caring about our satisfaction. And we become more irritated. So then we get angry unnecessarily when the hormones have also risen and all, then it becomes worse. Anyway, that's just by the way. So I wanted to ask if you can educate us a little bit on how a cyst develops, because it's about the release of the egg and the egg not moving from the fallopian tube to where it has to go for it to die off and melt away as menses, isn't it? When the egg stays in between the tubes and it grows into a cyst. I mean, I just want to, and because lately it's become a bit rampant. A lot of women seem to be developing cysts. I've had one and it's so unbearable. It's painful than labor pain, my dear. It's so bad. Okay, thank God I got over it, but I want you to educate us on, at least I believe once in a while, every woman should go for some screening to check your system. When there's anything, they can see it early and take care of it, but if you don't and it grows, then the younger ones who are expecting pregnancy, the cyst will block it, so it won't happen. Then you could have ectopics and all sorts of complications. So once in a while, as a woman, you need to go for a screen. I didn't know I had a cyst. The day the doctor told me there's something there, I argued with him, even with some multiple fibroids in my uterine lining. I was like, how dare you say I have a fibroid? I don't have signs of fibroid. But apparently I had multiple fibroids, and it was pushing my IUD out. So it was misplaced, but it didn't drop out. That's to add to it to say that IUD, as they are saying, it doesn't drop out. I've had a situation where the sling came off, but the copper was intact. It's just that it was misplaced, so they took it out and fixed another one. but hardly would it just drop out. When it gets misplaced, then maybe your partner will be feeling it chooky, a bit pricky. So your partner can tell you there's something wrong, and that could make you go check. Okay, so that's, but to me, the IUD, the non-hormonal, is one of the best options. You just have to go to the right person. You go to the professionals to fix it for you, and you are good to go. If you don't go to the professional and they don't do it well, you will be having intermittent bleeding, and that's also not good.
Okay.
So thank you.
Thank you so much, Auntie Esther. Before any of our panelists come in, with regards to her question, wanting to know if when the eggs go up there and they get stuck is what causes the cyst. And just to add to her question, someone actually sent me a question asking that with the implants, will your husband feel it? Will his penis hit it when you guys are having sexual intercourse? Is that true or it's not true?
That won't be the implants. That will be the IUD.
Okay.
IUD is what's placed in the womb. Implants
Okay.
is placed
Under the
on
arm.
Yes.
Okay.
No, IUD is placed in the womb. It's not in the vagina. It's not at the cervix. It's
high up in the womb, where your baby lies. There's no way the man's penis can go
By the strings.
into the womb.
Yes.
It's just the strings. But
Some
even
people
that,
say they feel the strings. They don't.
No.
And someone says they feel it.
No. The strings gets soft. Okay, the strings is so thin such that you're not supposed to feel it.
Okay.
Plus it gets soft and it curls up high up in the vagina at the cervix. So you don't feel it when you're having sex.
Okay.
No.
Great.
Okay.
With regards to the cysts
Yes.
and the formation of it.
So with a cyst, it doesn't have to do with the egg being released and getting stuck in the fallopian tubes. The cyst happens, so ideally, the ovary that releases the egg is in another smaller pouch with fluid around it. So when the egg is released, that pouch is supposed to burst for the egg itself to come out. And then that pouch is supposed to shrink. But for some reason, it fills up with fluid again. That is where the cyst comes in. Okay, so the cyst happens after every ovulation. When instead of the pouch to shrink, it fills up with the fluid. It's not something that happens because you did something, but the fact that you're a woman alone puts you at risk. Hormonal imbalance can make you get the cyst, and not
Infection.
ever having children also puts you at risk. Okay, because the more you are ovulating, the more you are increasing your risk of getting the cyst. That's basically that's basically what the cyst is about. Exactly. But like you rightly said, it's always good to have yourself checked. Every once in a while, just go see a gynae, let them do a scan, check if everything is okay, do the necessary lab test and all that, and be sure that you are fine. It really works. Because there are certain things that you want to know till it's too late.
Right. I don't know if Mrs. Yoki
Sometimes
has.
infections can also affect that the pouch. Infections enter and then they grow there because that place has a lot of blood. Because the egg itself is made up of blood products. Yes. So if any of it is infected, that is where they thrive very well in the fluid. Yeah, and that is why those things happen. We are saying that if possible, maybe before you get married, we have premarital counseling for screening for fertility and all those things. And ideally, we are saying that to be couples should go through that counseling so that at least you know me, I know you. You know what happens to me when I'm in my period. You know what happens after. You know everything, my cycle, because environment, work, lifestyle, your genetic makeup,
Right.
everything affects your cycle. So if anything happens to any of this, either the environment, either your lifestyle, either your work,
Your diet.
either your diet, yes, it affects it. So at least if we go through that counseling, we take couples through all those things so that at least at a point you even know what to do. Maybe because of the kind of work that you do, you need to do one or two things so that it will reduce your time of having maybe pain or having the cramps and all that during your period. There are a few things that you need to do. And when you do it, then that's it.
Okay.
When ladies come and complain about severe menstrual cramps and all that, we tell them, just take a plain tea. If you like green tea, fine. Yeah. Just take it in the morning, hot plain tea in the morning when you are in that side, that phase of your cycle. It relaxes the muscles. The pain comes, and it's because the inner lining will have to wear. And for the inner lining to wear, there is a contraction. And the contraction causes the pain. And sometimes it is very, very, very bad, severe. And it's like some people get sick, they even go for admission. We have to administer drips and so on before. They go through all that. But if you know it and you are able to observe it, sometimes when it's coming, you have the sign. Immediately you start having the signs. You start to do 1, 2, 3, and then you are okay to go through it.
Right. Thank you so much. I'll allow Priscilla and Bama to ask her question, then we can continue.
Yeah, so I wanted to ask, we've heard, or should I say I've heard, that exclusively breastfeeding for the first 6 months postpartum can serve as a way of preventing pregnancy. I want to know how true that is, because they also say that once you start introducing solids, some way, somehow, your body is ready for pregnancy. So I just want to understand.
Thank you.
That is very, very true. Sometimes we take undue advantage of that and then be doing anything. For you to be able to do use it as, we call it lactation amenorrhea method. So lactation, you are breastfeeding, exclusive breastfeeding. Exclusive means that when the baby comes out, for the first about 30 minutes, you have to put the baby on the breast. And then every hour, every 2 hours, you have to breastfeed the baby. So even if the baby is sleeping, you have to pick the baby up, put her on the breast by force, by fire. You have to take the breast milk. You see, we are saying exclusive because we are not adding any food. You are not adding any water. I remember in the time we are having our babies, our mothers told us that the breast, one is food, one is water.
Yeah.
So you don't need to add water. If you express the breast and then leave it there, you will see that it settles and there is water on top. And then you see the food under. So why do you have to add water? We are saying exclusive breastfeeding. Once you have not had your period, you can use it. You have not given any food. You have not given any water. You are breastfeeding exclusively. You can use it. It is just for 6 months. To 1 year and 2 years, because you've not had your period. The moment you start giving the supplements or other foods, adding other foods to the breast, you can't use that as family planning again. And that is why our Muslim sisters, when they deliver, the husband will say, Galat, go to your mother's house. Go and stay there. And it is for that time and you know, that time to you eat well. That's that time, fufu and kwai, benku, every hour your food is ready. So it's like the breast is nourished with all the things that you are eating at that time. And all those things have protection for the baby. It goes into the breast milk and it's for the baby. Those who do exclusive breastfeeding, I think they will testify to it, that the children don't get sick because they are protected. All the medications that you took during pregnancy, they are all in the breast and they are all working. And therefore, it protects the child for a lot of things. A lot of things. We had a client who had twins. And for you to feed twins exclusively is not easy. But she said, Mommy, I don't have anybody to help me, so I don't want my children to get sick. Therefore, I will do the exclusive. But at a point, we saw that she was getting exhausted because the two guys were terrible when they hold the breast and they are sucking. So we gave her a grace period. But before that, we inserted an IUD for her so that at least it can save her from getting pregnant so she can continue. So once you have your period during the 6 months, you can't use it as family planning. Right. Once you start adding the feeds, you can't use it. And therefore, if you start giving water, you start giving other feeds, you have your period, you can't use it for the 6 months. You have broken the law, and therefore, the law will not protect you. Yes.
So the issue is not about the food you are giving, but the rate of breastfeeding reduces. So the more the baby sucks, that's where you get the benefit of you not releasing an egg and you not getting pregnant within that 6 months. But if the frequency of, you don't give the child enough time to breastfeed, and you may get 3 months and you may get pregnant because that frequency of the child sucking the breast milk, which will have a way of preventing from getting pregnant, will be lost. So it's not about you saying, I'm giving water now, so I'm waiting, I want to get pregnant, so let me give water to the child and I should get pregnant. No. But the rate of you breastfeeding the child is what we should look at. Yes, thank you.
Right. I can see Auntie Phoebe. Okay.
Add this. When you are breastfeeding, especially those who have delivered, you will just see that you will feel it. That when you are breastfeeding, you will feel a bit of pain in the lower abdomen. It means that whatever that is going on, as the child is sucking the breast, there is this connection between the breast and then the uterus going back to its normal state. Yeah, so that's what happens.
Right. Auntie Phoebe, please ask your questions.
Thank you very much. I just want to know that between a man and a woman, who should be actively working to prevent pregnancy?
This one, I'll answer the question.
Now, I'm asking because, you see, a woman, sometimes just before you even have your menses, you may have some struggles. Maybe some pain here, you know. Then after that also, some people, they will not have any problems. Some people too have some abdominal pains and all that. And during ovulation, as you also described, sometimes if you are sitting on the pot, as if something is, so you understand me. You see, look at all the stress that a woman goes through. I mean, just a normal life. And then if you look at all the methods of planning a family, I don't think there is any one that is 100% safe or 100% side effect free. So, I mean, how do the men contribute? How many methods do you have for the men? And how many do you have for the women? And I mean, averagely, it's only very few women who are so sexually active that if I want it now. Very few. So between a man and a woman, who should be actively working to prevent pregnancy? Thank you.
Thank you. So somebody asked a question that is in connection to what she's saying with regards to the contraceptive tips for men. Is it only one, or are there more? As she said, how many do the men have?
So, Safibi, I think when it comes to the issue of planning the family, it's both the man and the woman that should come to an agreement and work towards it. I don't think we should have, let's say this is what the men should do 95, the women should do 5%. I think it's something we should all do together as a couple. And it's because women get pregnant, that is why almost all the methods we have, majority of them go to the woman. If men were to get pregnant, we also get the same thing because we produce the hormones, we produce the egg. So there's a need for consensus building in the home between the man and the woman. But we are having more methods for you because you are the one who releases the egg. You are the one who prepares the uterus for the baby. You are the one who will, hold the baby till the baby comes out. So it's not intentional that you have very few for men and a lot for the women. So that's what I want to say.
Yes. So how many contraceptives do men have?
Only two. Two.
Condom
for men.
and then
The condom and then vasectomy. These are the only two. Yes.
But when I was talking about it, I mentioned it.
And men have only one hormone, but women have two. That's the reason why ours is more than the men. They only have one. They only have one passage for urine, for sperm. They only have one passage. We have two. Yeah. So as we have more. Yeah. And that is why we have more
methods.
More methods.
And with regards to the vasectomy, is it reversible?
No, I mentioned earlier it's permanent.
Okay, so the men have temporal condom and then permanent.
And then permanent, exactly. They only have options between the condom or permanent, unfortunately, yes. Based on this, family planning is such that a woman can decide to do without even the husband's consent. Okay, so I'm also trying to answer her question with that. So,
is that advisable?
Yes. So,
because there was a case when I was in my national service then, at Mamobi. The women who said they are going to the market, they pass through the family planning unit to get the injection before they go home.
Yes.
The husbands were not aware. One of them got to know. They brought tax to come and beat the nurses up at Mamobi because why will you give this to my wife without my notice? There should be a way.
That is where, okay, so the bit is, like she was saying, and you also mentioned, the woman is the one getting pregnant. She's the one going through all the stress. She's the one going through all the body changes. So she can decide for herself whether she wants to get pregnant or not. It's not advisable, but then we still give them that option. Okay? You can have some husbands that are very difficult when it comes to family planning. They don't want you to get pregnant, but they don't want you to do family planning. How else am I supposed to not get pregnant? We have some men like that. We've actually had a lot of clients who come to our place without complaint. There are some husbands who want to have sex every day, yet they don't want the woman to get pregnant. They don't want her to do family planning. Exactly. So when we ask how, then we give the woman the option. Please, come and do it. We will keep your card for you. Your husband won't even know. Because even with the IUD, when you insert an IUD and you don't mention it to your husband that I have an IUD, he won't know. So you see, when you ask the question about whether the man will feel, the man won't feel anything. So he won't even know. So even though it's supposed to be a decision between the couple, I mean, we advise that it has to be between the couple because we are always happy when we see a couple walking in for family planning. We are always happy when we see that. But it looks like a lot of the time it's only the women who come in. When we have a couple coming in for family planning, we see them first. because we are trying to encourage the men to be more involved in this whole decision making. It makes it easy for the whole family. You understand? So it's better if the man is also involved. Otherwise, the woman can take that decision herself.
Yes.
I don't know if you want to add.
Add on to what she said. You know, we all have the right to life. And family planning is a lifelong something if the woman decides, so that the woman has the right to choose whatever that she has. And that is the reason why even when you come, we give you all the options, then you choose. And then if other conditions, you can't use whatever that you have chosen, we give you the other options as well. We had this client who came with the husband. The husband brought her, oh, by me, oh, do. And she one. So we inserted an IUD, and they were fine. So the man decided to go for another jingly lady. Yes. Because the woman was looking nice, he had putting on a little weight, but she was on the IUD. Say, unim se won nyema. Udidi pa. So the man said, oh, then she is not going to marry the woman again. So she brought the woman to the clinic. That once she brought her to come and do the family planning, we should take it out because the woman says she's leaving him. So we took the woman in, that we are going to take it out for her. Then when we went in, we asked her, Mommy, do you really want this thing out? She said, Madam, this thing, how it has helped me. And this man, if I remove it today, I know he will try to come back through the back door and say he wants me once again. So I don't want you to take it out. So luckily, somebody had just come to remove the IUD. So we just packaged the IUD nicely in a tissue for her to go and give it to the man. This is your IUD. Take it back so I can take my life back. You see? So when you come, even when you come as a couple, we talk to you. And the woman says, I want an IUD. The man says, I want you to give her implant. I will tell you straight in the face that what she will say is what I will do, because it is not about you, it's about her. It is about her life. Whatever that we put there, she feels whatever. So why don't you give her the option to choose what she wants to use comfortably?
Right.
So this is how we go about it. We had a client who used the IUD for 9 years. The husband was asking, hey, now what kind of family planning ni biana? She said, yes, you. She used it for 9 years, and then she later came, and then it was taken out. By the next few months, she got pregnant. I said, that's just a walk away. The card was with the mother. The card was in her mother's house. So, yeah. So the woman has a right to information, to choice, to life. And therefore, we wish that if you even come with your husband, you will give the woman the option to choose whatever she wants. And then you support her. Because when we are doing anything and we feel that you are supporting us, we do it with some vim. So that is what happens. We don't want a situation where the man will come and be slapping us and then insulting us and then saying that meanwhile you don't want her to get pregnant. You want sex every day, and I am considering
Yeah. Please, we have room for 2 more questions. I see one here. Just a moment. I see one here. So if you do have a question, kindly come and sit here so that you can ask your question. So only one other person can join the gentleman. But somebody asked, you mentioned that with regards to the cycle, the average 28 days, so you check your ovulation, the 14th day of the cycle, starting from the beginning of your menstruation or your period. So someone wants to know, can one get pregnant only one day in the month? That's one day in the month. Is that the only time that a person can get pregnant? Ask Mrs. Yoda, what is going, is that it? Or what are the ways around it?
So, number one, you don't know which day the egg will be released. So, I think it's between 3 to 5 days before, 3 to 5 days after. But you may have an answer because of the way you use the cycle beat. But you don't know which day it will be. So, you may have 28-day cycle. You're expecting that 2 weeks from the time it starts, if you start on Wednesday, next 2 weeks Wednesday, you're expecting to ovulate. Maybe you ovulated on Tuesday or Monday, or it will come on Thursday, Friday, or even Saturday. So you can take the rest.
So then what's the advice? How should you consistently have sex to give you optimal chance of getting pregnant?
Okay, so ovulation is one day. Okay, like Auntie was saying, it's just a few hours. Ovulation is just one day. When the egg is released, it stays for just a few hours, and then the body absorbs it again. So there's something we call ovulation kits that we can give to women who are trying to get pregnant and don't exactly know their ovulation dates. It would also depend on your cycle. Okay, so when we are able to know your cycle, you're supposed to be able to monitor your cycle for at least 6 months so that we know your cycle. If we know your cycle, it's easier to tell the range that you would possibly be ovulating. We can't tell you the day you'll be ovulating. That's why we use the ovulation kits. So the ovulation kit, when you use it, it tells you whether you're ovulating that day or not. So that if you want to get pregnant, if you have a positive mark on the ovulation kits, then you know you're ovulating, you can have sex on that day. Yeah.
Right. And those, maybe the person doesn't have the opportunity to have their kids, but what we counsel couples who want to get pregnant is that if after the period, you don't have to have sex every day. You have sex every other day. So that at least if it falls on any of the days, pregnancy can happen. Yeah.
That's right. Thank you so much. Every other day. Please, are you ready with your question? We are ready to take your question.
So thank you very much. My question is more Bible-based than scientific. And because you're having this discussion in a Christian context, that's what I'm asking. One of the natural ways you prescribe for pregnancy prevention was the the withdrawal method. And as Christians, we know about the very famous narrative in Genesis chapter 38, where one of Judah's children got killed by God because he withdrew and spilled on the ground. So I'm asking, is this method, this natural method, in line with the word of God? And as Christians, must we apply that?
So he's talking about the withdrawal. As Christians, are you supposed to be withdrawing when you're having Makion?
So I think Desmond, so if you look at that chapter, right? Judah, the child that was given to, the one that was married to the lady died. He was supposed to, with their culture, marry the lady, procreate, and then the family heritage continues. He didn't want to do that. So I'm sure God killed him for the intention of not doing what he must do for the woman to get pregnant, to have children, to extend the family, but not necessarily the withdrawal or the act that he did. So that's my understanding of it.
It was because of the intention.
The intention that he would not.
He was just trying to be wicked to the woman, and then also to stop the lineage of.
Yes.
The dead brother. So it was the intentions. that destroyed him, not the act.
It looks like his question has been answered, so he's going back to EC. Thank you all so much. That's the last question for the day. I'm going to give my panelists the chance to give me their final words on the conversation so far. So I'll start with you, Frederica, your final words on this topic.
Okay, so our conversation was basically on contraception. So I'll just say that contraception is safe, okay? Anybody and everybody can use it. We don't want to dwell on hearsays when we are dealing with contraception. There are too many hearsays. Hearsay. There's too much hearsay. And sometimes when you listen to all those, some people who have even done the method and they don't have a problem decide to come and take it out because of what somebody said. We always encourage that even if you hear something you are not sure about it or you are not comfortable with what you heard, come to the professional, ask your question, and let us tell you. We don't tell you what you need to hear or what we think you want to hear. We tell you exactly what the thing is. Some people always go around saying, even the nurses who are telling you to do family planning, they don't do family planning. It is not true. We are all doing it because we know the benefit of it, okay? So if you have any concerns or you hear anything, or maybe you are using it and you're having some experiences you are not sure of or you're not comfortable with, it's always better to go to the hospital or go to the professional. Not just talk to anybody. Because it's not any nurse who knows about contraception. It's not any doctor who knows about contraception. There are people who actually study it to be able to talk about it. They are the ones you're supposed to talk to. Go to the family planning unit. Okay? Sometimes you have a gynecologist giving you wrong information about contraception. They are gynecologists, but not everybody really does reproductive health or contraception as part of their course. So they tell you what they know. And most of it is also based on hearsays. So it's better to always go to the unit to have first-hand information before you make your decision or before you decide on anything else.
Thank you so much, Frederica Makian. Your final words.
Yes, so I'm reading from the church's statement on birth control. It's even on the church website. It says, for those who choose to bear children, the procreative choice is not without limit. Several factors must inform their choice, including the ability to provide for the needs of the children, the physical and emotional strength of the mother and the other caregivers, the social and political circumstances into which the children are born, and the quality of life and the global resources available. We are stewards of God's creation and therefore must look beyond our own happiness and desire to consider the needs of others. So family planning is within the Christian virtue. Look at the mother. Think about the mother. Think about yourself. Can you take care of this child you are bringing up? What's the situation around you? I was telling someone that for those who are, let's say, there's a war in their country and they are on exile, why don't you focus on running away to secure your life? But they give birth along the way as they are running away, bringing the children also to be part of their struggle. So let's look at the situation around ourselves also in order to determine to get pregnant. Let's not give people pressure. When am I seeing your second child? Someone sees me and says, your boy, how old is he? He's 3 years. When are you giving birth again? When are you giving birth at all? So there are so many questions that comes in and puts pressure on people. Then let's limit that and give people the chance to make a choice for themselves. Thank you.
Thank you. Mrs. Abigail York, your turn.
Yes. I think they've said it all, but I'll just add on to what they said. You are thinking of planning a family. You are looking at your finances. You are looking at your age and all that. So if we know that women, some have their menopause as early as maybe from 35 or 40 or 45, then you have to know when you want to have your children. So right from day one, then you plan, okay, if I start to have children, now everything is fine with me, everything is fine with my husband. So we will have to, now most of our mothers are working. So now you don't get your mother coming to sit when you deliver for years, taking care of your children for you so that you can go out there and work. Grandma is also going to work. So we have all those things. And things are changing every day. The school fees, the supplements, the feed, the everything, diapers. Now we don't have napkins, washing napkins, and then using it for years. We don't have that. We buy Pampers. And the Pampers, if you are not careful, you will buy about 4 or 5 packs in a month, which is not very cheap. So you look at all those things before you say that, oh, me ya me ba kope. And you know, mana me mami anwoni nyina, oh, me yere wo be wo amame. Please, please, let's consider all these things. You know, yes, anything can happen to anybody at any time. The uterus or the womb is like the balloon. As it's blowing up and then going down,
On Elder Samnya Kumensa to give us the closing prayer now.
Shall we rise and pray? Our Father in heaven, King of kings and Lord of lords, we are thankful for this afternoon. We thank you for the discussions that have ensued this afternoon. We know and believe that it has gone a good way to help us and also to influence that of those who are connected to us, those who are close to us. We thank you for the lives of the resource persons who put everything aside to come and educate us and share their knowledge with us. May you continually bless them, bless their families, and bless all their endeavors. Father, as we depart from here, we ask that the Holy Spirit will continually abide with us. May you be present in our homes, present by our sides, present in our midst, that the enemy will never have it his way close to us. Father, let your light shine in us, that others will also see the good lights that you have placed in us. We are thankful for an answered prayer. We have said these and many others in the mighty name of Jesus, pray with thanksgiving. Amen.
All right, so a very big thank you, like Evie said, to our wonderful resource persons, and to you, those who join us here, and those who also watched us on live. We say thank you. May God be with us all. Amen.